right, so for ADHD, you probably know that the first line of treatment for medication is stimulant medication. So this is usually Ritalin, Concerta, Adderall, medications like that, okay? And for about 80% of people with ADHD, they're going to notice some good improvement with the stimulant medication, okay? And usually only 2 or 3 different medications need to be tried to see a good benefit, okay? For people who don't see a benefit from a stimulant medication, they may need to move on to a different class of medication, such as an antidepressant medication, hypertensive medication, or an anticonvulsive. So these are some other types that are used if a stimulant isn't helpful, okay? One thing to understand about stimulant medications in the brain is that they are very short acting. So if your child is on a stimulant medication, it is not staying in their brain very long, generally a matter of a few hours, or for the longer acting medication, still a day. The next day, the medication's already out of their brain, okay? The common side effects that we see with stimulant medications are things like loss of appetite, weight loss, trouble sleeping, and sometimes motor tics, which are involuntary movements, sometimes things like or an eye blink that's involuntary, and that can be a reason to discontinue the medication, okay? So those are the main side effects that we sometimes see with medications. What the medications do, when we're talking about stimulants per se, is they help improve the level of a chemical in the brain called dopamine, okay, which is not optimized in people with ADHD. So the stimulants make it so that the dopamine levels hang out in the brain longer for the people with ADHD, and then they have a better time with focusing, paying attention, and they're less hyper and impulsive. And that's the key benefit that we often see. There have not been a lot of long-term studies about the effects of ADHD medications, particularly the stimulant medications, if someone is taking it for years and years, in terms of how it may affect the developing brain. There was one study that was started in the 1970s and followed a period of several years, many years actually, 100 children, and they were not shown to have significant differences in their brain development to people who did not take the stimulants long term. Overall, they were shown to have some height growth suppression, though, on the stimulant medication. And that could be due to the fact that the stimulant medication can cause some suppression of appetite. In terms of other studies that have been done in more recent years, there have not been studies that have shown any kind of brain growth or brain volume size change from being on stimulant medications for a long time. There are some studies that have shown that the way a person's brain responds in the environment in terms of the chemical responses may be different for those who have been on stimulants for a long period of time, even after they go off the stimulant medication. However, the implications of that kind of brain response change is not really clear and more studies are needed, okay? So at this point, my overall analysis is that we don't have a lot of good long-term research on the implications of long-term stimulant use for years and years and years, except for that it's possible that it could stunt physical growth a little bit, okay? The other thing I'd like to point out about ADHD medication is when you're on medication, you're getting a benefit in terms of decreased hyperactivity symptoms, decreased impulsivity symptoms, and so you're able to focus and perform better, hopefully at work or at school at home. But it's not going to teach your child skills. So a medication is not going to help your child learn how to raise their hand appropriately in class. A medication is not going to teach your child turn taking. A medication is not going to teach your child appropriate social skills with peers, appropriate peer behavior. If your child's having some self-esteem issues related to ADHD, medication's not going to help in that arena either. So there are some benefits from medication in terms of just reducing the core problem areas of hyperactivity and impulsivity. And for some kids, that hyperactivity and that impulsivity is really high, and it's hard for them to function at all. They're so hyper on a daily basis. But medications aren't going to teach you those adaptive skills that you need in your day-to-day life to function at school. And that's where behavioral treatment, behavioral therapy, comes in. So therapy usually focuses on building specific skills in problem areas. So for example, when I see a child along with their parent in treatment, we work collaboratively to focus on key problem areas. We identify those areas, and then we decide which to target first, second, third, and so on in order of importance. One thing I want to point out is I work with the child to determine how they want to try and solve the challenging behavior, okay? I don't try and impose my solution on the child because that's often not successful. I see a lot more success when I work collaboratively with the child and I say, do you have any ideas about how you could be more successful in math or how you could get your homework done at home? If they don't have any ideas, that's okay. I've got a ton of ideas, but I always start with trying to problem solve with the child first. We also work on social skills frequently in therapy too, because those are often a little bit lagging in kids with ADHD. Okay. So the key point I want to make there is that some of those major skills that need to be built up in kids with ADHD are not going to be affected by medication.